going to squeeze in here. Hello there, and my name is Dr. Karuna Satori. I'm going to be performing your surgery today. I'd shake your hand, but I see that the anesthesiologist and nurses have just left the room. Usually there would be a nurse present, but unfortunately we are very low staffed due to the pandemic going on. But you have nothing to worry about. I have performed this surgery 1,000 times. So all I need you to do is let the drugs take effect. I'm going to be administering the full-blown twilight sleep medication, which is called propofol. And all you need to do is just take deep breaths and enjoy the ride. I know that surgery can be a very, very frightening experience, but it really doesn't have to be, as long as you have the right doctor, and I can promise you're in good hands. So with that being said, I have a few things I need to do to you before we can begin the surgery this evening. I see here you will be spending the night. Can I see your bracelet, please? I know you're kind of unable to move, but if you could just move your wrist for me so I can peek at the name to verify. Good. And I do have consent to touch you. Thank you. Good. I know I have to anyway, but it's a good way to establish trust between doctor and patient. You will be leaned up facing me for this surgery, so I see you're a bit reclined, which is good. I have my light back here, and it's going to guide me right around here to perform. And they have given you all information on what's going on, correct? Good. Okay, so we've pretty much done everything on the chart. Everything else will be recorded by the computers behind you. So I'm going to be very up close to your face throughout today's procedure. Again, you're simply going into a twilight sleep. Some patients stay awake, other patients kind of drift off into a relaxing place of a beach or a bed, a more comfortable bed than a hospital one. I'm going to go ahead and remove my jewelry. That way I can apply the gloves when needed. But right now we're just going to do a few vitals and get them recorded on the computer. We must wait a while for those beginning drugs to kick in. I believe they gave you gabapentin to start a pain regimen. Probably Neurontin as well, which is a form of gabapentin, and I do believe they did give you just a hint of fentanyl. And no worries, it's not enough to form an addiction. I am a former addict, and it took a lot to stay 9 years clean. I promise you're in good hands. But we want those pills and liquids to work prior to operating. If you start pain management prior to a procedure, the brain processes it as healing rather than focusing on pain receptors. Okay, so I'm just going to go ahead and slip your arm right through here. a little slow, probably due to the medication. But all in good health here. So, have you ever heard or had surgery before? I know. I think what makes it scary is the fact that it's kind of like always either a really dim lit room or the surgery room is really bright. They always have you, sanitized down. It's very, very uncommon, but at the same time it's necessary. We couldn't just bring you in from the outside without, cleaning you down, putting an antiseptic where we're operating. So, as much and as frightening as it may be, I promise it's for good reasons. And everybody else is dressed in the same material rather than having, a difference. It's all the same, which I think gives an uneasiness, but I promise in reality all surgeries in all hospitals are for good. You don't have to worry of something going wrong. I think hospitals lack to tell us, me being including a patient at times, that the risks of surgeries and procedures like these are very, very low, and it's really up to your doctor to take care of your body and help you heal. So you have nothing to worry about, okay? Just trying to get my hair to fit in here. I'm just gonna go ahead and check your breathing, check your lungs for a moment. I'm gonna go ahead and place this on your chest and on your back, so we'll start down here, okay? I'm going to have you take a deep breath for me. And hold. Exhale. Very good. Go ahead and inhale for me. And hold. Go ahead and breathe. Okay, we're going to move on to the back here, right below your lungs. Go ahead and breathe normally. Good, okay. So, your breathing is normal. It's actually very relaxed, and even with the medication administered, that's very, very, very good for someone who came in here with a pretty high heart rate. But again, I know for surgeries and procedures like this, it's pretty difficult to have an entire room of nurses and doctors calm you down when they do have to worry about other patients. But your health is always number one, and that's why you're here in the first place, okay? I promise from here on out, any surgery you're going to have to deal with is absolutely for the best. It's all to heal you and all to help you. Okay, so you might have seen me use this pen a few moments ago. I'm actually going to be using it to mark where I'm going to be making the incision and performing the surgery. I'd rather not tell you how I'm going to do this. I kind of would like it to stick between you and I, because again, all I need to focus or have you focus on is relaxing. You can stare at me, you can watch my hand movements, kind of a gentle, relaxing amount of touching and moving around during this procedure. Some people call it autonomous sensory meridian response. It's a very long, drawn-out word for something that should be very relaxing. So I'm just going to go ahead and start marking. And that's about it. Just going to make the incision and remove what's needed to be removed or worked on. And we're going to suture you up and just do a few things. So nothing to be concerned about. No worries on something bad happening. Consider it like a relaxing experience almost. Okay, so I'm just going to get very up close here, right below your eyes. And can you lift your head up for me? Just up, up, a little bit more, Alright, my dear, I'm just going to do a few measurements of this area to make sure that it matches. Don't worry, I'm sanitizing. Okay, so measurement should be 3 centimeters across, about 4 wide. So just starting right here at the tip, right below here, I'm going to just, okay. Very good. And one more just to match. Okay. Alright, my dear. So what comes next is administering the anesthesia throughout your IV. So I just have a few things here. One of them being antiseptic. We're going to clean the area prior to doing what needs to be done. How's that? But your propofol remains right here. Antiseptic remains right here. Okay. So I'm just going to grab the syringe right here. Good. Alright, are you ready to relax? I promise things are going to be just fine, okay? Okay. Here we go. Right here in your IV. Are you ready? Okay. Just pushing the plunger down now. Take some deep breaths. No reason to be anxiety ridden. Deep breaths. Deep breaths. Deep, deep, deep. Okay. Your eyes are becoming very heavy now. I know. And again, you can happily watch me do my work, or you can fall asleep. Either way, you're in good hands. Good hands. I'm going to be dictating the rest of this process. So I'm going to turn on my recorder here. No, you are not going to be recorded. You are going to be recorded in audio, but nothing visual, so no worries. You did sign a consent form for that. Okay. Patient number 2207, ready for procedure number 230. Currently removing cotton pad for sanitization of area. Procedure should take less than 10 minutes with proper sanitization. Okay, applying antiseptic to area. With cotton pad. Good. Applying light to patient as well as preparing scalpel. Scalpel has been sanitized. Going to make incision and let blood cauterize before removing what is needed. So, okay. Good. Checking patients' pupils, see how they react to light, how anesthesia is working. Excellent. Okay. And one more. Good. Ready to make incision, applying gloves. Patient's vitals are stable. And incision number 1 ready to be made. Okay. To use. Okay. Third incision to remove. We'll prepare a cotton pad. More antiseptic. Excellent. So, refocusing light. Okay. Okay. And beginning to peel back, incision, using focus light to work with. Blood beginning to appear, patient's vitals stable. Going to apply mask for the duration of removal process. Okay, patient blood is cauterizing. Going to prepare scraping and peeling for removal. Mirror is handy. Going to go ahead and begin to peel back skin. Peeling. First layer. Epidermis removed. Getting ready to peel back second layer. Excellent. Excellent. Coming in with light. Okay. Good. Excellent. Ready to begin scraping process. Coming in with cotton pad. Okay. And beginning the scrape and removal. Excellent. Patient's vitals still stable. Relaxed breathing. 99% oxygen level. Good. Okay. Coming in with inspection light. Mirror. Good. Going to remove mask as we finish process of removal. Very successful procedure so far. Going in with suture, preparing bond serum, just a pinch of antiseptic. Okay, blood removal. Blood level remains normal. And now sterile suture has been attached. And here we go. Suturing open wound. Very little blood, which means area is healing. Thank you, previous pain management. Small cotton pad. Good. Blood is clear. Almost finished. The suturing process. Good, very good. Just tying for ability to be clipped. Applying cotton pad number 4 for antiseptic. Blood has since dissipated. All proper suturing to prevent large scarring in area. Vitals are a bit fast. Propofol clearly beginning to wear off. Going to administer second round of pain medication. Gabapentin, 200 milligrams. Oxycodone, 25 milligrams. Patient will be subscribed 10-day pain management in regards to both Neurontin, muscle relaxer, and oxycodone, 10 milligrams. Applying second round. Good. Applying second medication. Good. Patient appears to be, follow the fingers. Patient does appear to be awake. Hello there. You did amazing. I explained nothing would go wrong. You have to be numb as can be by now, and I can only hope with all of my person that you are just feeling amazing, sweetie. But you did great. And you are all fixed up. We removed and scraped out what needed to be taken away. I am currently dictating. I'm going to finish that now. Patient is stabilized, awake, and very relaxed in this moment. Going to have them ingest some type of yogurt, graham crackers, and or soda at this time, and allow 1 full day, 24 hours in the hospital prior to release. Good. Yes, you did so well. I told you, surgery's nothing. It needs to be done if it's required and asked to do so. If it's a cosmetic surgery, that's a whole other ballpark. But for now, you had done what's needed to be done. You will feel mild discomfort in the upcoming days, but I have already written you a script for 10 days of pain management. You will do fine. And with that being said, I'm gonna let you sleep, sweetheart. A nurse will be in around 4 times this evening just to come and clean your wound and check your vitals and administer any pain that is needed or required. So with that being said, I'm going to go ahead and turn this light out and get my things, and we will be on our way. Good night. You did so well. You'll see me in the morning.